Well, good afternoon to our friends in the EU and on the East Coast. Good morning to our folks in the middle of America and then further west. I hope everyone's doing fantastic. I'm Frank Dolan from Arsenal Advisors. We're really excited to get the community together and do a little bit of a conference recap. This is a little bit different for us, but we thought the community is asking so many questions about kind of what's going on. And with this biopharma meeting, especially around such a big topic when it comes to all things digital. Talk about terms that are used so much, but this whole digital thing, great. But they had a face-to-face component, which is really, really interesting. And we're all curious, what happened at the meeting? Were there bigger and better insights or experiences because people were there live, but also these folks put on a virtual component as well. We all know virtual conferences and all the great things, also some of the challenges that come with that. So we'll do a little of a compare and contrast, see what was the feeling, what was the experience like, and more, and kind of bring it to all of you, because I know many of you probably weren't able to attend. But we're going to hear from a bunch of cool folks today. We're going to run through a lot of people here over the next 45 minutes, so buckle your seatbelt. It should be a lot of fun. And by the way, on LinkedIn Live here in the chat, please feel free to go ahead and engage with us a little bit. So really my first question, if you want to put it in the chat, when you chat, we know who you are, which is great. So we just want to say welcome to all of you, but let us know, did you attend? And if you did, that's a yes. Did you go to the live event or did you do the virtual event? So live or virtual are your two flavors if it's a yes. And if you didn't, let us know that stuff too. That way I can tell all of our speakers who attended DPE live and also virtual to give them a little bit of context as they're framing some of those answers. Okay, so first off, we're bringing in Eric Gubera, EVP of the Life Sciences Practice. Eric, welcome to the live stream.
Hey, it's great to be here. And it was great to be in Philadelphia, I have to tell you, Frank.
Yeah, I'm curious. So I've got a couple specific questions for you, and then we're going to start bringing some other folks up. But let's kick it off with what was Digital Pharma East live in Philadelphia? How many people were there? What was the feeling? What was the tone?
I don't know approximately in terms of people coming in and out, but the numbers were robust, and the rooms were full on the sessions. But it was really I was surprised by how full it was and how dynamic and well run it was. Highly organized and a well executed event.
So on that note, Eric, maybe give us a flavor for trends and themes. So when you think about all the emerging solution providers that were there, many of our biopharma executive peers that were speaking, but even I think it's like that offline conversation that you're having in the hallway or before, after these sessions, that's really interesting. What would you say kind of like struck you as a surprising theme or issue kind of facing the industry right now?
I think the top line thing that I pulled away was that there are new solutions to age-old problems, and some of them not that age-old. Some of them that I was experiencing in the field as recently as 2020 in the COVID era of the hybrid model that's been emerging. But I would say the top three things are HCP engagement, new and better ways to engage the under fire healthcare professional who's managing so much these days. Emerging strategies and capabilities and for patient adherence, but also patient engagement, and compliantly engaging in finding patients and groups within the social media space and pharmacy adherence. I mean, we all know in pharma how challenging it is. Once a patient starts on therapy, keeping them there and supported over time can be a challenge, especially in this disruptive age, managing the pandemic. And the third piece, and to me, I was a bit gobsmacked by this. There's never been a shortage of data available for life science companies, and it just reminds me of the that old data everywhere, but nary an insight to be found. So much of it is siloed and things like that. And it really slows up both clinical development and post-launch operations. So what the solution providers are able to do, streamlining this and providing actionable insights in real time, and being able to see those things in person. Quite frankly, it was inspiring. Executives who were there, I was super encouraged by how connected they were to this process and committed to bring some of these innovations forward to patients, and gathering together from different companies, sharing their wisdom, not secrets, but sharing their wisdom about how to pay these innovations forward to patients, because ultimately that really is the end game in this. So I was completely inspired and motivated.
I like it. I like it. So, so on that note, Eric, let me just, you mentioned the word innovation a few times. Let's build on that a little bit by bringing in Hans Kaspersets. Hans, how are you? Welcome.
Hey, Frank. Hey, Eric. It's good to be here. Thanks for having me on.
It's great to have you. So, Chief Innovation Officer, Relevate Health, formerly known, or a part of it, formerly known as Arteric. One of my favorite guys. I can tell you that when it comes to growing a mustache, you are now my inspiration. So there's going to be a dream board for everything. So I'll have to work on that a little bit. But hey, tell us about your experience. Like, you went there. I don't know how many face-to-face meetings or conferences you've been to lately, but give us a lay of the land.
Yeah, and by the way, Magnum, that's the name of the mustache. He says
Magnum.
hi. Yeah, it's glad to be here with you today, Frank. He was also at DPE. So I think this was my third in-person event this year. I went to a much smaller event a couple weeks earlier, I guess 30, 40 people total in Boston. It was kind of a strange experience. There was some fist bumping, there was some hugging, trying to decide, when you walk up to each other, how are you going to greet each other is always interesting. But the key thing is, I mean, it was really good to see my friends and to see the people I've been working with for 20 years in this industry. The human connection in this business is crucially important to advancing and to innovating. It really suffers when we're separate. And while we've done a really good job over the last year interacting and over Zoom and whatnot, to be in person and to have dinners and to talk freely about how we can change the world and help people live longer, healthier lives is really, really important. So that was really probably the best part. I got to meet Eric in person, which was amazing. I mean, I've been talking to Eric over StreamYard for I guess a year now, and so that was really, really good too.
Well, that is excellent, Eric. Eric, you're back. You left us for 2 seconds.
I apologize for the technical difficulties there. I was afraid I was so fired up I might have shorted the Wi-Fi here at Casa Rivera.
Hey, look, it's it's lunchtime on the East Coast. You're just telling me that that your Uber Eats showed up and you had to step out. I understand. I totally get it.
Caught, busted.
Very cool. So Hans and Eric, I'm going to turn this over to you in a second to help us with some follow-on questions. But Hans, maybe give us your outlook when it comes to trying to get everybody more comfortable with these face-to-face meetings. Yep. The upside of what happens face-to-face versus the virtual stuff. You think this is going to come roaring back?
Yeah, the short answer is yes. And really an interesting couple of things came together. I actually went to the MMM Awards a couple of nights ago in person as well in downtown New York. And it was even better. When we were at Digital Pharma East, when we were in session in the big room, basically everybody had a mask on, right? When all 260 or 80 people were in a room, everybody's masked. When we were out on the floor with the vendors walking and doing the networking, it was like 50-50. If you were eating or you were drinking something, you might be maskless. But if you were just walking around talking to people, you were masked. And so I think there was a really good sort of respect for each other's space and each other's comfort with each other. And nobody had to be told to put on their mask. There was no sort of like stress around it. It was like it just happened naturally. And then the nice other thing was we all uploaded our vaccine cards and proof of vaccination before the event. So we went into it really feeling really, really comfortable. And I think having that level of security and comfort with each other created much better interactions. I will tell you, when we went out to dinner one night, everybody sat at dinner maskless, and we just really had a really good conversation and lots of wine flowed. So it was a good conference.
Very cool. Very cool. Well, Hans, can you stick around for another minute?
Yes, sir.
All right. So we're going to add more folks to the Brady Bunch Squares. So I want to bring in a good friend of ours, Bob Lemke from Mobile Locker. Bob, welcome. Why don't you introduce yourself to everybody, and then roll into your experience at DPE.
Fantastic. Hello, everybody. So Bob Lemke here with Mobile Locker, equity partner. I run the revenue side of the house for Mobile Locker. So fantastic to be here. I appreciate the opportunity to be with all of you today. So from a kind of a recap perspective from my standpoint, I kind of agree with a lot of the things Hans said. I was very, and Eric as well. I loved the conference generally. I thought, given the circumstances, the just coming together for the first time in a long time, everybody did a fantastic job, from the organizers to the to the presenters, to the folks that were just in attendance. I thought everyone was very respectful of the situation, took a great opportunity to network wherever it was possible. I thought that everyone was very engaging in every opportunity they had to be engaging, right? So in the rooms, great questions, great engagement from the panels, from the audience. I think that was almost like people were really happy to be there, right? So people were thrilled to have the opportunity to be participating. And I think there may have even been a little bit extra energy as a result of that, right? So from my perspective, I thought it was great. I thought that, it was just great to be out about communicating, interacting, and just generally, I thought it was a really, really good experience. I would encourage anyone out there, if you're on the bubble, or if you're a little bit on the fence about re-engaging in these types of things, I think that it was done with ultimate, to Hans's point, respect for the situation. And if you are kind of on the fence, I would urge you to to really kind of get out there, because I think it was done safely and effectively, and just a well-run event.
Very, very cool. So, Bob, why don't you, and I know that from a time perspective, we want to get those big things out. So if you said, hey, look, you didn't attend the meeting, that's okay. If there's one thing that's on everybody's mind, that's our peer group, our biopharma, medtech, executive peers, like our peer group, this is what they're thinking about. What might that thing be?
Yeah, so from my perspective, I kind of was struck by what I thought was two key themes in the sessions, right? So number one key theme was this idea of HCP engagement through innovation. Eric touched on it, right? New innovative ways to engage with the market, right? With the HCPs. And then, from a personalization, digitization, there was a lot of talk and discussion on that point. So that seems to be very top of mind, which is, of course, near and dear to our heart here at Mobile Locker, because that's kind of what we do. And then the second piece that I thought was kind of very relevant and very top of mind from the sessions across the board, actually two things: omni-channel. So this whole concept of having the capacity to gather all sorts of data, insight, information from multiple engagement channels, use that data and insight to get better at whatever you do. So I thought that there was a pretty solid focus on that. And then the third thing that I was struck by that seemed to be a really solid theme, pretty relevant throughout the conference, is this whole direct-to-patient relationship stuff. So pharma companies coming up with new innovative ways to build direct relationships with the patients. And there was quite a few and a handful of sessions that touched on that as well. So all about engagement, I think, obviously, is kind of the general theme. How are we engaging with our clients, our customers, our end users in some form or fashion? And then different types of engagement, targets, HCPs, patients, and then putting all of that data together in the most innovative way to get better at it, to get better at personalization. How do we target messages to the perfect people, to the right time, where they are, with information that delivers value to them, whether they're an HCP, a patient, a payer, whatever it might be. So those kind of themes to me kind of jumped out, and I thought they did a pretty good job mixing them up, giving good, solid content across the board on all of those themes.
Very cool. Yeah. So while communication channels may change, communication strategies, right person, right time, they stay the same. So very cool stuff, Bob. Thank you for that. Hans, I think you had a question for Eric and Bob.
Yeah, thanks, Frank. Bob, it's really good to see you.
You as well, Hans.
Bob and I got to meet in person at TPE, and I met his partner, Mark, who's absolutely brilliant. So it was really good. I was wondering if you guys experienced something I did. I felt like the pharma executives that I ran into, the brand executives I ran into, were hungrier than normal to have conversations with new partners and to really talk to us. I mean, historically, right, they get overrun by vendors trying to get in their face and trying to get their attention. And everybody I talked to was just much more open than in years past to have a deeper conversation and to explore new partnerships. I heard a couple people talk about it from the stage who were presenting from the brand side, saying, hey, yeah, no, we do want to meet with partners. We do want to see them because we need new solutions. Did you guys experience the same thing?
So Hans, I would jump in and say 100%, violent agreement with that, right? So I thought that from a just things like looking you in the eye, like as a vendor, right? So you go to these conferences as a vendor sometimes, and you get I'm not even gonna look you in the eye. They see you make eye contact, they literally turn the other way. Yeah. You get all of that kind of stuff. This whole concept of, oh God, that guy looks like a vendor, I'm out of here type stuff, right? That you do get at a lot of these conferences. But there wasn't a lot of that going on here. There was a really, I thought, collaborative spirit of engagement that was very sincere. And again, I didn't think it was because anyone was told to do it. I didn't think it was anyone was encouraged to do it. You just kind of got the sense that, to your point, they were hungry. They were hungry for information. They were hungry for interaction. That they were just out there to learn and collectively open, right? So everyone was just open to relationships, to learning more about each other and more about what you're doing. And because again, it has been a long time. So gosh, there's been a lot of innovation, right? There's been a lot of things happening out there. And I think that people recognize that, and they were very, very open and willing to listen and engage and learn, ask questions that I thought were really relevant. So I could not agree with you more. And that's why I found the conference in general to be kind of just such an uplifting experience.
I think one of my observations, just to piggyback on what Bob said, was this concept of test and learn is definitely alive and well. And these are really, I was like a kid in a candy store myself, because just learning about these new capabilities and capacities that solution providers are delivering, there's definitely this really wonderful spirit of let's test and learn. If we're going to fail, let's fail fast, but let's make sure we're aware of some of the options that are out there. And I think this opportunity to close the execution gap and look outside the castle walls of these large and complex life science organizations is they have talented and focused people that are out there doing that. At least a handful of life science companies that were out there. So I was very encouraged by that. I mean, Bob hit the nail on the head. These folks are willing to pay these innovations forward and get to know and learn about this digital renaissance. They want to experience it.
All right, so I want to bring in Matt McNally, because Matt's going to bring us some perspective, because Matt, not only did you attend and we want to know why you did, what your objectives were, but you are also influencing the discussion there. And I thought maybe you could just help the audience relive that experience. So first of all, welcome, Matt, and glad to have you here.
Thanks. Thanks for having me. Excited to be here. I mean, not to reiterate what everyone has said, but I think going in person created just a world of difference. We've spent 18 months going meeting to meeting, And we probably have seen the biggest transformation in healthcare, I would say, since the early 2000s when digital started to take off. So we really haven't had the headspace kind of going from screen to screen to have the conversations to really unpack and figure out how we address a lot of the key themes Hans, Bob and Eric have all talked about. How do we innovate in this world? What does omni-channel look like and what does it really mean? What does personalization? So for me, I went hoping to get a lot of those, downtime with one or two colleagues or clients to have those conversations. And it definitely happened. I'm excited for the next one. Like I would go to one almost every week because I just think everyone was excited to be there. To be a little provocative, I think everyone is head nodding around a lot of the trends that we're seeing. And I was fortunate to be able to moderate, I think it was day 2, the omni-channel track, about 5 different sessions. And I think there's a lot of head nodding around, how do we become more personalized? How do we integrate across channel? But we had a really great conversation in our rooms about, yes, it's about channel, but also now a big theme was, as you're looking at the role of HCP's involvement in getting a patient on script is very different given the pipeline. What's kind of that role of DTC, and not just omni-channel, but how do we better integrate HCP and patient communications? And again, to be provocative, I think what's scary is we start talking about, well, whose job is it? At a typical pharma company, sales and marketing is siloed, HCP and consumer is siloed. There's not a chief marketing officer like there is in other categories kind of driving that integration. And even agency partners and partners in data and tech and publishers are isolated by channel, where now more than ever, we kind of knit those things together. So we were talking a lot about, well, whose job is it? And what does that look like? Do we need new roles at pharma? Or is there a new kind of agency model that really helps pay off on a lot of the things that I think we're head nodding on as key trends? So I think for us, for me in particular, I think we're all aligned a little bit on where things are going, but we're in this bit of a awkward moment of like, well, how do we get there? How now do we capitalize on these things and deliver better for patients and providers?
I love it. That is always the goal. And Matt, I think that when you say that, that means a lot to the biopharma audience. I know from my experience at 7 different biopharma companies. I mean, regardless of how the launch went, the numbers went, the stock went, at the end of the day, the gas that gets you to the office every day is that whole patient mission, which is it's good to hear that is a big part of the narrative. So I just want to kind of like reset everything that's going on here. So folks in the chat, thank you for your contributions. By the way, we're watching that stuff come in. If you have questions for Matt, for Hans, for Bob, for Eric, or yours truly, please go ahead and ask them. I want to bring up one more person here on the stage that's going to help give us more perspective, and that's Matthew Crandall. Matthew, welcome.
Hello there. Great to see you guys.
Good to see you, Matt. Give us just your quick bio for the 4 people in the audience that don't know who you are. Tell us a little bit about yourself and why you went to DPE.
Thanks so much. I've been in healthcare a long time, but I recently switched from point of care to patient engagement. I joke, point of care to point of caring. We actually hold patients' hands, and we're relatively an unknown company. So I really wanted to go there and meet people, learn, and build some awareness. But our company is also about human to human patient engagement. And so the human to human client meetings were awesome. But I agree with what everyone said, but really the haves and have nots. I think all of us at the show were comfortable being around people, hugging, being awkward, fist bumps, but there's a lot of people that didn't go. So I think, like consumers, the health community is still up in the air about how engaged they are in meeting people. And people were rusty. It was really funny to hear a lot of speakers not used to speaking, not sure what to wear, forgetting they have to book a ticket before they jump on the train. So for all the people planning to go to the next meeting, there's just a little bit of catching up and dusting off, some dust and cobwebs. People were printing business cards because they didn't have them for the last 2 years.
Matthew, I felt like Matthew just shared with the audience everything that happened.
Same.
Yeah.
I'm totally laughing because I printed business cards before I went. I had to retake notes. I didn't know how to pack a work suitcase, which I could do 10 minutes before I had to get an Uber to the airport. So yeah, dusting off the old in-person chops, so to speak. Matthew, you're spot on.
That is hilarious. That if there isn't a golden takeaway from today, folks, I mean, there it is.
And we all felt a little bit in different ways.
Very, very cool. So, so folks, I've got a few questions for you. And so please feel free. Let's find a cool way. I know we have a lot of people on screen, but let's find a cool way to knock out some of these. Okay. So question number one. In fact, I'm going to give some extra color to this one because it's something that's very much been on my mind, something I've been writing about and speaking about quite a bit. And that is, as we share our experience at a conference that was face-to-face, kind of in this, hopefully a post-COVID era, fingers crossed, that we're moving into, we did go through a very unique time for the world, for everyone personally and professionally and beyond. If we want to narrow it down to biopharma specifically, there is no question that many of the drug launches that occurred during the pandemic had very, very mixed results in comparison to certainly, Wall Street expectations, internal expectations, and certainly when we gather a lot of HCP or patient information, there's clearly been, an awareness disruption as far as even knowing how to get involved in some of these new brands. And that turns into dollars and cents, which ultimately turns into patients not served by those medications, which is a tragedy if they should have been on that medication. So you've really, depending on who you're talking to, you've got billions of dollars of launch revenue that was not accrued for various reasons. And with many in-market brands, there's been disruptions to their revenue model. We've reset forecasts, that whole 9 yards. So the world has certainly changed. When it comes to the customer experience and knowing that we're going to have to be agile, does anyone have a couple tips or tricks that they've gathered along the way that they would share with others who are responsible for brands that may be going into a launch in the near term on how they're going to reinvent that customer experience with an agile model that takes lessons learned from COVID, but also gets us closer to the results we used to enjoy pre-COVID? Anybody?
If I could just jump in, just quickly and succinctly, your strategy really needs to be about customer-centric and patient empowerment and understanding where those two key elements are residing, because that's one of the things that's been super dynamic and has changed significantly even within the past 6 months, including the demographics of healthcare professionals. That's changed significantly. So I think the real pivot that needs to take place has nothing to do with technology. It has to do with the mindset of life science companies shifting from an inside out, splatter the countryside with, one message, one thing, across the country. And it needs to go to more of an outside in, starting with the customer, starting with the patient, because patient empowerment is the thing I'm most encouraged by an emerging trend. And so the patient is king. And I think the life science companies that direct and focus their strategy in that area are going to be the ones who connect better and serve more patients in the end.
Okay. All right, Bob, you're up next.
Yeah, so I agree with a lot of the things Eric said in terms of some of the ideas around pivoting. But for me, I feel like it's a lot about velocity, right? Just moving quickly. Everything is changing so fast. And if COVID taught us one thing, it's that things change, right? And things change really fast. So having platforms, having technology, we're a technology company. So, it's a little self-serving, but our message is have technology platforms that allow you to move quickly, to react, to be proactive versus reactive. Just have that capacity to constantly be ready to move fast, right? And the other thing that I would argue is a very relevant position is seek innovation on the edge, right? So what I mean by that is big tech companies are not necessarily known for innovation. They're known for following. They're known for watching things happen on the edge, and then they adopt, they buy, they acquire the technologies that are happening on the edge. But when you need to move quickly and with great velocity, you need to kind of look for those technologies on the edge that are doing just that are allowing speed and allowing agility, allowing to, I think somebody said it earlier, to fail fast and succeed quickly, right? Those are things that I think in this new era, in this new world that we're living in, I think a lot of it is about speed, innovation and speed. And when you can marry those two together effectively and successfully, I think you're going to be out ahead.
Speed and agility. Yes. During part of my big pharma experience, I'm not quite sure if I knew what that meant. Hans.
Yeah.
Thanks,
Keep it
Frank.
going, my friend.
So,
Hans, what do you think?
Yeah, if there's anything that COVID reinforced for us, it's that healthcare is local. And that's a really important insight to sort of re-recognize, because, when we looked at, COVID sort of wash over the country, like there were different hot pockets. I mean, even today, you can see those things happening. And so it really reminded us of that. And, when we think about launching RX brands or growing brands, right? I mean, access is really localized. The physician behavior is really localized. The incidence of disease and prevalence of disease is really localized. So being able to access data and insights about that is a transformational thing. And, when we look at DPE, right, you've got IQVIA buying DMD, Medidata, right? You can see the consolidation of the data players in an effort to get better acuity, right? You've got Deep Intent was there, Komodo was there, and all of those players are helping us to gain insights. So the same thing with Relevate Health, a little bit self-serving, but the truth. The other thing that happened was the noise level went up. And so the way to sort of combat these things, and we supported 5 launches. The first one being one that was supposed to go live in March of 2020, which we delayed till June. We had to figure out ways to break through the noise. And the key to that is to increase relevance to your HCP audience. And how do you do that, right? So you use local data to gather local healthcare insights, you use local peer influence, and then you really target those messages in a way that captures the attention of those audiences, those HCP audiences on a sort of a local level, but then done at a national scale. The extension to that, and this is something we heard at DPE, was that customer experience has become really important. And I believe it was GSK or one of the big pharma made a presentation where they talked about customer experience and bringing in the customer experience practices from the apparel industry into pharma, and using that in order to increase the relevance of their content and to improve their engagement and the experiences their physicians are having. As an extension, right, that's one presentation. I was on the phone with Big Pharma yesterday, and I was on the phone with somebody who's the head of customer experience who had actually come from Apple and joined this particular Big Pharma in order to drive their content strategy and relevance practice. So, you look at it, right, it's like, what data can we use? How are the data players coming together to get deeper insights? How do we create richer, more relevant experiences? And the final piece, which I think we're all going to work towards over the next couple of years, is how do you measure relevancy and tie it directly into ROI and RX lift? And I think that's the next sort of frontier that we're all working on.
Cool. I like it. Okay, so we've got inside out, outside in paradox. We've got speed and agility, an element of hyperlocal. Matt.
So I'm going to go a totally different lane. I agree with all of that, but I also think it's empathy, and it's around content and messaging. You look at even HCP communications, HCP burnout given the pandemic, like all of us, at an all-time high. We oversaturated HCPs with digital communications because we all swung so far digitally because we couldn't get to see them face to face. I think Viva gave a stat. I think HCP digital outbound communications were up 488%. So I think, yes, it's tech, yes, it's data, yes, it's throwing out the old playbook, but it's also about how we are interacting with physicians. What are we delivering them that's going to be of most value? And same with patients. There was a really great conversation with Jack Barrett, a pharma manufacturer who's slipping my mind, and then Rael Brown, who's an eczema patient. And he asked her, what do you need from big pharma? And I think about this even from launches. She goes, we need the how, and we need empathy, and we need step-by-step. So I think back to this idea of we used to create comms on a one-size-fits-all messaging, kind of a one-size-fits-all media plan and comms plan, but really this idea on how do we more personalize launch experiences and inline brands as well to really deliver for physicians and patients is key. And I really want to echo that outside-in lens is huge. Bringing an outside of pharma lens in to drive innovation and to launch brands new is critical.
I love it. Matt, thank you. That is empathy and personalization. Gosh, when you think of the scale of by which we're all being communicated to constantly, things that aren't personalized just become the easiest things for me to filter, because I don't have a new information problem. I have a filtering problem. But boy, I feel that extra effort when it's truly personalized with what I do. And we're all work very closely with a lot of HCPs. I know that they really appreciate it as well. So on this particular question, Matthew, bring us home. Your thoughts on thinking new about this topic.
Yes. Well, I hate when the room is always turning on a shiny object every year. This year is a legitimate one. I mean, every discussion and thought was in the lens of COVID, because it's really changed society. It's changed everything about how physicians think to how we reach them, and patients as well. So some other things that, pharma's got to grapple with that start to come up here are meeting patients where they are, which includes at pharmacy, through telehealth, and in new creative ways. I love what somebody said, thinking in ways outside of pharma typically does. Also, health disparities. I heard a lot about that, and that's another place where we've got to change the way we do it because of COVID. These disparities were always there, but now it's at the forefront. Now we're challenged. What do we do to address Black community, Hispanic community, other communities? And it's bringing things to the forefront that we never really wrestled with before to a good enough extent.
That's excellent stuff. So a couple round robin here real fast. Matt, Hans, Bob across the top of my screen. Hans, and you kind of touched on this a little bit. So face-to-face intra-industry meetings, 50% back, 100% back, or unsure?
So you cut out the first part of me. I heard 50%. Sorry.
Oh, yeah, no, I apologize for the live stream. Yeah, so when it comes to intra-industry meetings, face-to-face stuff, do you think that we're coming halfway back, 100% back, or unsure?
It varies. I mean, I would say 25% would be super optimistic for this. I would say for the next 6 to 10 months.
Cool. And Hans, you felt more strongly, higher percent?
So I just sat in a 3-day planning workshop with one of our oncology clients, and that was face-to-face in New York. And there was 15 of us in the room. So it's starting, and we've got some clients in California that's had us out, but the majority of our clients don't want to see us in person at their offices yet. I think that we're going to see the vanguard of this in the conferences and sort of the bigger gatherings where there's a rationale for it, where it'd be really hard to get people from different companies together in the same room for a meeting. So I think it's coming, but it's going to be a slow roll.
It's going to be slow. Bob, your thoughts?
Yeah, so I think my thoughts are kind of variable, right? It's still going to be variable for a long time. Depends on things like geography, things like, kind of where you live, somebody said earlier, healthcare is local, kind of what is going on locally, right? What's the local political environment? What's the local, because I still see it, even my friends who live in various geographies, some people are still very, very, very hyper aware and hyper concerned and hyper, whatever the word might be, right? And so other people, if you go to a different geography, it's kind of like wild, wild west, and nobody it's just kind of all bets are off, right? So I think there's still a little bit of that dynamic, fluid kind of ebb and flow that's going to happen for quite some time, right? So the smallest little thing that pops up in the news is going to be, it's going to be a lot bigger than it used to be, right? Those types of things just seem to have a much bigger. Anything that happens in the news is a giant rock being thrown in the pond, not a little pebble, right? And there's just things like that I think are going to continue to kind of flow, and it's going to continue to be a little bit fluid for a little bit of a time. But hopefully with like the things that the right precautions in place and people being smart and respectful and all those types of things, we can get there.
Cool. So speed and agility counts for 2 answers today with you, Bob. I like it. Very, very cool. Eric, then Matthew. Dr. Gubera, did you have a point of view on
about whether the meetings are back and the face-to-face?
Yeah, your thoughts.
At the large, I was also just at DTC this week. It was not as well attended as prior years, of course, but Somebody said, is it, sad to have less people in the room? I said, it sure beats my living room. I'm here with half the people that I would normally see, and that's better than none. And, as several of the presenters said earlier, it's about those that really want to learn and network and be engaged. So, when you go to a big room, there's always a lot of people that aren't really into it 100%. When you go to the meetings, they're going to be smaller, but the people there are really there to work.
Very cool stuff.
I'll just build on Matthew's comment. I think being selective and thinking strategically about what you want to accomplish, and I think maybe Matt brought this up earlier, or someone else, like kicking the dust off, so that you can have that in your arsenal of tools to engage with other people. And when it comes to addressing healthcare disparities, I'm pulling something from one of the discussions. This digital transformation is sort of a little bit uneven in terms of who's able to participate in that. So that's another piece. Like sometimes putting yourself out there and getting outside of your comfort zone. I'm not saying to be unsafe at all, but getting outside of your comfort zone and making sure you're engaging broadly in the community in which you live and work. I mean, let's start there. Let's start in community first and make sure we're getting out and connecting the dots and making sure we're engaged with others who are just like us, that are hurting and confused and really wanting to be included.
Very cool. Well, speaking of included, I just want to thank all the members of the 38,000 biopharma executives that follow our musings on this stuff. I hope you guys enjoyed the conversation today. We get together again for the Medicine Market Summit coming up in early November, so I hope you'll join us. That will be virtual, but we will be back to Harvard, Stanford, and Wharton, hopefully in 2022. Eric and I will be talking about that this afternoon. But I just want to, on behalf of the audience, thank everyone for their time and treasures. Matt McNally, thank you so much for being here, Matt. It's great to see you.
You too.
I appreciate it. Hans Kaspersets from Relevate Health, thank you so much for giving your time.
Thanks, Frank. Thanks, Eric.
Bob Lemke, taking time away from a round of golf or beyond. Thank you for giving your time and treasures. I appreciate it.
I left my 3 best holes out there, Frank.
Make sure there's an eraser on the pencil on the scorecard. At least that's my secret. And Matthew Crandall,
right,
Matthew, always good to see you.
Yep. Talk about health any day. Thanks for having me.
That's a deal. All right. On behalf of our entire panel, everyone, thanks for joining us today. We'll see you on the next live stream.
Bye-bye, guys.
See you guys.
Bye, guys.